So good day, friends. This is Dr. Bob Hamilton, and you have tuned in today to the Hamilton Review, where kids and culture collide. Before we start, I always say this every week, but thank you for tuning in. It means a lot to me. I know that all of you you're busy. You're trying to get ready for the holidays. You're zipping around here and there, and I get that. You're shuttling kids and trying to put supper on the table. The fact that you tune in means a lot to me. If you like what you hear, and I hope you do, share it with your friends, share it with your family. We're building an audience for the people that I bring on the show, and today is a special day. I have a friend and also a colleague. Dr. Deborah Lynn is in the studio today. So, Dr. Lynn, say hello to the group. Okay. So, who is Dr. Lynn? Well, Dr. Lynn is an adult and kids adolescent psychiatrist. She's also a psychoanalyst. She did her training at the Southern California Psychoanalytic Institute, which has now changed names to
the New Center for Psychoanalysis. So
the New Center.
Yeah, mm-hmm.
And she did her Child and Adolescent Psychiatry at UCLA, my alma mater, by the way. Mm-hmm. And now is in private practice in Westwood, California. Pediatric child psychiatrists are really, really rare people, friends, and they're very, very valuable people. So the fact that you're here in the studio, I know that every minute of your time is like somebody wants to talk to you. Somebody in need wants to talk to you. So thank you. I appreciate the fact that you're here. So, Deborah, the way we do it on this show is I ask my guests to say a little word about them, their background, where they grew up, and maybe a little bit of your journey. Very few people become pediatric psychiatrists.
Yeah.
And so what were the steps along the way, the points that caused you to do what you're doing?
Well, I always like to start out with saying I'm a Hoosier.
Okay, that's fine.
So in California, like people are like, what? What is it?
That's in Indiana, by the way, if you're wondering what that means.
Indiana. Listen, I grew up in a, poor, not poverty, but low middle class or low, family, like food stamps family. And I'm actually the first person in all my extended family to graduate college. And so that's, that's leading up to the fact that, I graduated high school from Carmel High School, which is, it's a great high school and has since ended up being like a really great high school. Anyway, and so, from that, I was admitted to the Northwestern University honors program in medical education, which meant at 17, when I graduated high school, I was already in medical school.
Wow.
So, and I knew no doctors, nobody, but I just was like, that's a good job. so I'll do that. And so it was, it's a very competitive program. And, but so the idea was you go to college for 2 years and then you go straight into medical school. Sure. It was like a leftover program from the World War II, where they were trying to pump out doctors, faster. Yep.
By the way, I think I like that program. I think that that paradigm, which is relatively uncommon,
and
they may have done away with that.
They've done away with it, yeah. Uh-huh.
But the idea is that so much of some of the undergraduate studies that you end up doing are not terribly pertinent to medicine. Yeah. And so you kind of dive right into the medical. So that is a 6-year program from the beginning to the end. So you were a doctor when you were 23, an MD at 23, 24?
Yeah.
Amazing.
Yeah. Right. That's exactly right.
You're like about several years ahead of the usual MD.
I ended up, right. Yeah. So that being said, in undergrad, you were in the Northwestern program. Because your grades didn't really matter. You were encouraged. You had to take a core amount of sciences, but you were encouraged to take whatever you wanted. And your grades didn't matter. So I took a lot of upper level literature and history courses, which I loved. So I'm sort of happy for the program, because had I not been in the program, I would have fallen in love with, turn of the century English literature and become an English professor or something
Sure.
like that, so, but instead I, went straight to medical school, and I had done so much babysitting. Like I was a neighborhood babysitter. I traveled with families in my neighborhood for babysitting. I thought for sure I'd be a pediatrician. I mean, that was in my mind.
Wow.
But during my pediatrics rotation, for some reason, Bob, it just sort of turned me off. In retrospect, I think I was uneasy with, I think I was always meant to be a psychiatrist. Like I wanted to do in-depth things, and
Yeah.
so, and,
Yeah.
have time to like play with the kids or, kind of really connect. Not that, but, at the end of medical school, I had three resumes. I was either going to go into OB-GYN or, oncology or psychiatry. By the way, I had not ever even known there was a thing that was called psychiatry when I went into medical school. Like, my family, like, it wasn't, I never heard of a psychologist, like, so that wasn't a thing in my family.
That's very funny.
So,
It's interesting because pediatrics,
yes.
I grew up in a small town, and there were actually, now that I look back, there were pediatricians in the community. I thought there were only general doctors, because the
Yes.
community only had you would call them a family practitioners. They were
Yeah.
just called a doctor. They were general practitioners, but they were. And they did everything. They did my parents, they did us, they did
Yes.
everybody. And that was kind of how it was.
Yeah.
And so the idea of pediatrics was kind of a foreign thing for me too.
Right.
Yeah, even as a kid and getting into medical school, I kind of, oh, okay. So which is kind of, I know people are listening, kind of going, you guys grew up under a rock.
No.
I did, trust me. You can ask my wife about that. But anyway, it is. I totally get that. So we're relating to each other here. Okay?
Yes, totally. Right. And then for extra money during medical school, you could work as a psych tech or mental health worker
Yeah.
on the inpatient adolescent psychiatric ward, which was nuts. It was at the phase where, which I like better, where kids stayed a long time. It was a more psychoanalytically oriented psychiatric unit where they employed a Winnicott, who was a famous
Yes.
pediatrician
Yeah.
and
Mhm.
child psychiatrist and
Yep.
child analyst. His concept of a good enough mother or a holding environment, right? So this ward that we worked on at Northwestern was a holding environment, like they modeled it after Winnicott's ideas. So that meant there was open kitchen, like you could get snacks anytime. It was all soft. The kids weren't put in restraints when they went crazy. They were held.
Yeah.
And so as a medical students, we were always assigned like the most disturbed kids, right?
Sure.
And so I remember you'd sleep there overnight, but it was great because it was tons of food all the time. So there was lots of benefits. And, but these kids would go crazy. And I remember being like, having to subdue a 6 foot tall, out of control guy, and I had his leg, we were holding him down, and I went into the break room going, I will never do this job ever,
Yeah.
This is good as a money making, in medical school, but as a part of that, the analysts had weekly meetings with all of us medical students that was doing the job, and they were just fascinating. It was like my favorite thing, and so eventually, at the end of the day, I thought, do I want to be an oncologist? Do I want to be an OB-GYN? And I thought in those two fields, I really loved talking to people and being with them at the most birth and death.
Yeah.
And so I'm like, oh, I want to be a psychiatrist. So I went into psychiatry.
What kind of, in this ward, what kind of things were you seeing? Were you seeing like schizophrenia or?
Yeah, it was a big, huge floor with all anorexia. I remember I was assigned all the time to my first experience with an anorexic girl who was so skinny, and she would sneak exercise by doing her laundry of like bending down for each sock, and we had to like not allow her to do that.
Yeah.
And she was so malnourished that she would pull out her hair in tufts.
Wow.
And she probably stayed on that unit for a year.
Wow.
And so all the medical students got to know her, and like another kid had graduated to being allowed to have an aquarium, a little fish tank in his room, and got suicidal one night and drank the fish tank cleaner, so that was like a whole thing, these things I remember in my mind, so it was like a general psych unit, so.
I had when I first went into my training, I had a girl who had anorexia as well, and it was a new world. I mean, it was just so difficult to get through. And she always would pull up her skin and say, "Look how fat, Dr. Hamilton, I am. I'm so fat." And she would literally pull up her skin. Yeah. And I would kind of, "No, you're actually not fat. You're actually pretty thin." And it was, so but I don't. We never really got through to her. Ultimately, she actually passed over time. But it's tragic. But anyway, these are very complicated things, and sometimes are, I think, for people who are not suffering, they don't, it's almost, you can't understand what these people are going through.
Right, because anorexia really isn't about food. It's about, it's about,
your brain.
So deep issues. Yeah.
Yep. Fascinating. So you got out of so that was during medical school? That was
during medical school.
So that was like your weekends, you would do that kind of thing?
Right. And then, so then I graduated medical school at ripe old age of, however, 23, 24. And I did an internship at the University of Chicago, actually, which was really great. And then I went to, I followed my heart. My boyfriend at the time took a job at University of Wisconsin in his training. So we both went to University of Wisconsin for residency. And that didn't work out. So I came to LA for my child and adolescent psychiatry training. Okay. And that was going, I think it's officially going to be 30 years, because it was 1995 that I came to UCLA. So,
wow. Yeah. And you did your training there?
I did 2 years of clinical child and adolescent psychiatry. And then I did a research fellowship. And then I was on staff at, and my research was personality development and specific borderline personality development. Because what was happening was, I was, even though self-mutilation or cutting has been around since medieval times, but I think in the late 90s, it had sort of a surge. And I had been borderline queen in my residency. Like, I was the one that took on all the borderline personality disorder patients and kind of really tried to help them. And so I was fascinated to find out, oh my gosh, what, these 13-year-olds are coming in cutting themselves. Yeah. And so I kind of dived into that and tried to do research around it. It turns out UCLA, it just wasn't in the stars for me to be a researcher. I was a great clinician, so that was against me to be a researcher. Yeah. And at UCLA, you would get grants if you were going to study like the functional MRI of somebody cutting themselves, or something like that, and that wasn't really my interest, or serotonin receptors on their platelets if they were depressed, so I kind of I worked for a year with a rat model, if you can believe this, of a Leishman disease rat model. Sure. So self-mutilating poor little rats, and so I was like, okay, this isn't what I want to study. So yeah. The Leishman, certainly they bite themselves. Yes, right. Yeah, kids who kind of gnaw on their lips and their hands, and so it was little rats gnawing on their hands.
Crazy.
By the way, how we got them to do that was giving high doses of pemoline, which was an early, amphetamine-based stimulant, and so.
Wow. So you induced the Leishman behavior.
Right. And so, but that's always stuck in my mind. And we would do another podcast about stimulants and ADHD. These aren't benign medications that you can just, it causes agitation, And sometimes kids actually do end up, they come in with their nails bitten off, when they're on those stimulants anyway. So then I was on faculty for a minute at UCLA, and then in the year 2000, I just went into private practice, but I've been on clinical faculty at UCLA ever since. And I was always doing my psychoanalytic work, which now is separate in the field of psychiatry. It used to be all the chairmen of psychiatry people were psychoanalysts. You had to be, because you had to be that good to be a chairman. Now, that's not the case. You have to go outside.
Can you define maybe, because we talk about psychoanalytics and psychoanalyst.
Yeah.
I think Freud was a psychoanalyst,
Yes.
right?
Right. Well,
So
Freud invented
he
psychology,
avoided it.
psychiatry. He invented it.
So tell us, this is a little bit of an aside, but what is the difference between psychiatry and psychoanalysis?
Well, psychoanalysis, it's the original psychiatry. So Freud was a neurologist, and he had all these patients coming in with wacky symptoms, and he said, well, his people around him were like, what's going on? So, but what came of that is the idea that it's a deep dive into the unconscious. So it's the concept that the study of psychoanalysis acknowledges that a lot of how we think, how we behave, how we feel is dictated by our unconscious mind. And so basically when you become a psychoanalyst, you like years and years of studying theories of unconscious mind. Yeah. So then, and I believe it is really the most powerful tool. So if you're in an analysis, the idea would be you've got to come in frequently. So that's the idea of 4 times a week, 5 times a week, laying on a couch, free associating. Yeah. So the free association is so the clinician can use my study and my knowledge to kind of get a glimpse into what must be going on unconsciously. Yeah. So
are you trying to awaken that unconscious
yes.
and bring it to the mind of that person,
to bring it to their conscious mind,
and essentially uncover hurts and other things, other streams of undercurrent streams to manifest them, to show people here's what you need to work on. That's the idea? And so that they essentially can let go of the symptoms. So let's say an anorexic girl,
so she comes in, I just was on the phone last night with my patient who is in college and wants to be a doctor, and she's got learning issues. She's smart enough, but it's going to be a push for her to be a doctor. And her reasons that she wants to be a doctor are kind of narcissistically driven. She wants to be, it's kind of to prove something, like unconscious, an unconscious, an unconscious drive to be the best, or to prove that she's smart, or to tear away from her family of origin, which is a mess. But she stopped eating, and she had 2 spoonfuls of rice, she told me yesterday. And so unconsciously, I have to interpret to her, that's very interesting. So you're trying to do something that is a challenge and you really want, yet it's curious that you're doing something that undermines that. So I wonder if you were eating 2 spoonfuls of rice yesterday in the midst of finals, and is an unconscious agenda to sabotage yourself. So something like that. Yeah. And so hopefully by raising a patient's consciousness, then they can take care of the symptom, right? Yeah. They can go, why am I, I don't want to do that. Ooh, so I'm going to really try and eat healthy, fight against that drive. So anyway.
So that's psychoanalysis.
So psychoanalysis was the thing, right? So Freud was at the late 1800s, early 1900s, through World War II. A lot of amazing work and lots of brilliance was done around all that. But then there came medicine, and I think the story goes. The antipsychotics and some antidepressants were tuberculosis medications. Yep. And then they noticed that it helped improve the mood. So ever since then, and that started the road of psychopharmacology. And then some psychoanalysts at University of Pennsylvania, probably in the 60s or the 50s, said, wow, psychoanalysis is it's so costly, time, money, it's so laborious. But at the end of the day, what changes in people? Well, at the end of the day, if people have a good analysis, they're able to shift their thoughts. They're able to think differently. Yep. So that brought in cognitive behavioral therapy. So those guys said, oh, what happens? Oh, they stop black and white thinking. They stop catastrophizing. They stop future tripping, all those things, all the cognitive distortions. So that ushered in cognitive behavioral studies. Analysts were studying it. And they found in some of their studies that, oh my gosh, people start to feel better in 12 hours, like 12 sessions. The
Well,
insurance companies got a hold of that. And
yep.
for a long time, I don't know if you remember, if you were even cued in on this, but the insurance company said, oh, we're no longer paying for psychoanalysis. We are going to pay for cognitive behavioral therapy. And in fact, we're going to give everybody 12 sessions a year. So that was around for a long time.
Yeah.
And and it was so unfortunate, but that
Hmm.
pretty much was the
The
nail in the coffin for psychoanalysis because nobody could afford it.
So,
Yeah.
very interesting. I have to say that the insurance companies have been running medicine for a
Yeah.
long time.
Yes.
Another
Right.
example, friends.
Another
We've
example.
talked about this on the show before.
Yes.
Um,
So anyway.
so, okay, so you have, but you've been dealing with a lot of adolescents, and one thing I wanted to talk about on this show today was just about. You're a psychiatrist.
Mhm.
You spend a lot of time with kids and older people who have been traumatized by just the lockdown in general, but it doesn't only have to be the lockdown. But I think that there has definitely been, and there's been many, many articles out there in the lay press about the fact that there's a lot of anxiety. I think Jonathan Haidt just wrote a book called
Yeah.
The Anxious Generation, I think which I have a copy of that. Haven't read it yet,
Yeah.
but he's a great writer, by the way. But anyway, so this is your world.
Yeah.
And tell us maybe a couple stories and just kind of get into why we're dealing with this, what happened, why do we need each other, why is Zooming and being away from each other in terms of we see each other on the screen, but we're not really rubbing shoulders. Why was that so deleterious to kids, and why are we? What are you seeing in the aftermath of that?
Well, so the first thing that comes to mind is I'm going to go into a soliloquy about autism because the name autism came from Margaret Mahler. You know, she was an analyst who described like a child's development, and you probably remember. You know, in the first weeks of life, a baby's supposed to pop out of their autistic shell.
Yeah.
You know, so the concept is,
3 months.
yeah, yeah,
That's
exactly.
what it is. Yeah.
Yeah, right.
Yeah.
And so that's the word that they use to, how we use it today to describe autism, right? And so that concept that a person is kind of locked in
Yep.
their shell, and at the most severe autistic, patient, kids don't have language, right? So they're not even, popping out of their shell to communicate with language, So anyway, so I think the people that the kids that the lockdown probably hurt the most were the ones that were prone anyway to turn inward, and the conceptual regressing inward to an autistic shell, an autistic state, right?
Yep.
I mean, of course, I'm not saying like these kids turned autistic, but it was an encouragement to be inside their room, inside themselves, looking at themselves on the screen.
Mm-hmm.
The amount of I had a kid, and so who was a prime example of this. Just a adorable boy, born to a drug addict, eating disordered mother, and sort of an enabling father. The mom couldn't handle him his whole upbringing. That by the time he got to me, he was on Adderall and too much and too long, and it just
Yep.
what was being skipped was his learning disorders, but what was really being skipped was his family dysfunction, of course. So, but this poor guy, so he, the pandemic hit him late junior high, early high school, and to this day, I just talked to him the other day too. He's now doing well, but he and we joked, joked around a little bit about his body dysmorphia, which really started in the shutdown, right? Because he had to look at his face.
Yeah.
And he's a rugged guy, so he had acne, and he's a hefty guy, and so he isn't the Abercrombie and Fitch model type
Sure.
of face, and so he was forced to kind of look at his face and judge himself all day long, and it just kind of encouraged what was already happening. He was an only child with this dysfunctional set of parents. He was already turned inward. At some point at the end of the pandemic, I visited him, and at his house, and it occurred to me that, oh, he's probably watching porn all day, and indeed he just said, there's no porn that I haven't seen. So imagine that.
Well,
Imagine what's out there.
How old is this
He
child?
was like 15, 14,
Wow.
and it was destroying. That's a terribly overwhelming thing to for anybody, for me.
For a young teenager to be
just
digesting on a day-by-day basis.
exactly right.
You actually wonder what's going on behind in the darkness of those rooms.
Of course, yeah.
And I think, unfortunately, there's a lot of porn going on, and I don't think that parents are necessarily aware of that.
No, yeah.
I told you a little bit, just a brief comment from me. I had a mother I was talking to, and her kid went into the lockdown when he was in junior high as well. So the lockdown, right when he was going to go into junior high, suddenly he's no longer going there. And he became he spent his whole, not only school hours looking at, screens, but after hours gaming and all the kind of things that kids do, with TikTok and everything else. I'm not sure TikTok, but, all the other things, Snapchat and all that. So one day he walked out of the room, looked at his mother and said, "I hate you." His mother said, yeah, that's not allowed. And and it's kind of like, why do you hate your mother? What do you, and he was just that, exactly what you're talking about, that inward turning, that kind of that, it was almost like all of, listen, we need each other. We need each other to break us from that tendency toward narcissistic behavior, right?
Yeah,
and that's why you get married. That's why you have relationships. And if you have siblings, your siblings, or help beat it out of you too. If you grew up in my home, that's for sure.
Right.
How many you were one of how many?
I was the oldest of three, so
okay,
I did the beating.
You did the beating. Okay, you were the mother superior.
I was the bossy big sister.
Yeah, I had a big sister too. But anyway, the point is that we need each other, and we need each other in our lives, and that kind of internalizing I did. And so that mother, interestingly enough, she said, that ain't going to happen. She literally pulled the kid out of school, said, "We're going on a journey." They went around the world.
Wow.
And she yanked him out of school for like several months.
Wow.
And she had the means to do it. So they went to Tibet. They went to Africa. They climbed Kilimanjaro. They went all of the places, India, she didn't go to Europe.
Yeah.
She didn't go to, New York City where, you could live in luxury. No, she did the very opposite. Wow. And she told me, she said, "You know what? First of all," she said, "people thought I was crazy." She said, "I was compelled to do this." And she was a smart lady.
Yeah.
And she also said, "When I got back, I had my son back."
Yeah.
So listen, some of these things that kids go through, they're not permanent.
Right.
They need to have the jolt.
Right.
They need to, and you're part of that jolt.
Yes. Right.
So when you have, so that's one kid.
Yeah.
I'm sure you've had many.
Yeah. Yeah.
How do you begin to pull them back to reality?
Well, what I always tell parents, like, close, where does that come from? Close monitoring, like you have to actually engage with your kids. You have to actually, like what that mom did. Pull them out. Look them in the eye. And I was having this discussion actually with a parent who has a terrible drug addicted son. He's now 22, and I was giving my advice, which isn't what psychotherapy should do, but I was posing to him, like, what would happen if you just sat down and looked him in the eye and just had a honest conversation, and just at every turn, at every, you have to monitor the child every hour of the day. It really is, it really takes effort on the parent. So
Sure.
That's one thing. And, if I'm lucky enough to get them in my office, how do I work with them? Well, you hear them, you try and listen to them with not trying to interject and control what they're thinking, and just let it unfold, and you meet them where they're at, and just close monitoring. Just be very close with them in a non-hostile, non-intrusive, not not controlling way.
Yeah,
Just totally,
non-judgmental. When they get the vibe that you're judging them, they turn off, obviously.
Right.
I had a young man recently in the office who is struggling. He really is struggling. The cannabis thing is, people don't realize what cannabis is doing out there, but cannabis is really, listen, to a lot of friends, we've talked about this before on the show, but cannabis is, marijuana, people think about, certainly we at my age, people think about old-fashioned marijuana, where people are growing weed in the backyard and they make, cigarettes out of their cannabis leaves. But the new marijuana that they now get is they're the THC, which is the active pharmacological component of marijuana, tetrahydrocannabinoid. That is multiple times.
80 times.
80 times. Okay, there's the number, 80 times more powerful than the old marijuana that you got when, way back when.
Yeah.
And so we're talking about very high levels of THC. It's terrible. And you see it. What happens to these kids?
Well, now that it became legal, there's more studies on it, and there's not a single study that's saying, oh, it's really good. It's really good for anxiety. No, so the studies, the neurochemical based studies are showing how THC hits psychotogenic receptors in the brain.
Yep.
So and what else? And so the natural plant of marijuana has CBD. So that's THC and CBD.
Yep.
And the CBD is kind of a natural antipsychotic because the THC is a psychotogenic, drug. And so of course all these strains have low CBD and high THC, right? And not only that, but the kids are using wax pens or any kind of solvent. And so it's the equivalent of like huffing, and you and I know how bad huffing is. Like huffing destroys brain cells directly through your nasal passages. So it's so terrible. And it's just so prevalent. And I just had a kid come in, a 16-year-old kid, who for a year has been telling some therapist that he's having strange paranoid ideas, having not out and out hallucinations, but sort of hallucinations, or having to run out of places. And the therapist told him that he's just suffering from random PTSD, even though he didn't even have any trauma really. Yeah. And it turns out he's been smoking weed daily for a year, and he's having a psychotic reaction to the weed. Yeah. And and it's now he can't go to college because he's ruined his high school experience, and he's going to take having to take a year until he gets himself together to go to college. But it's and not to mention he's been really suffering, so I see this all the time, and kids don't believe it because guess what? They go on the web, on the internet, and they find out that it was ancient Inca healing, of the, marijuana was ancient Inca healing or something. And I'm like, okay, I'm sure that the ancient Incas, maybe you trekked 2 days to sit with your shaman, and maybe you smoked it once in your life and had an experience, and that's it. They weren't, trust me, the Incas weren't probably smoking it every day. I kind of joke with them about that.
They wouldn't have been able to make Machu Picchu if they were smoking it every day. I promise you.
Exactly.
It really does. It is, and it bothers me that the legislatures around the country are just they're going, marijuana is marijuana. Right. It's like alcohol. It's not like alcohol. It's very different than alcohol. Certainly, let me just say this, in the young mind. Yeah. Okay. In young kids who are teenagers, who are in that stage of so maturing their central nervous system, that has a very different effect than say other things. Yeah. So I'm not recommending alcohol either, but that's a true thing. So what do you see? We're talking to families here who some have teenagers. What are your recommendations for just good mental health?
Okay.
What kind
my
of things?
mantra lately. Okay. Go
Yeah.
ahead. Yeah.
I mean,
Yeah.
in other words, if you could lay out a handful of things saying, if you want to be healthy in your, I mean, look, listen, we're talking about making America healthy again. Okay. We'll see if
Yes.
that actually
Yeah.
happens, by the way.
Right.
But anyway, maha. I like
That
maha.
maha means
Makes
the
me,
greatest.
it makes me smile. But
Sanskrit.
but if in fact I mean, mentally, we talk about the body, okay? We talk about exercising and all that kind of stuff. What kind of things make the brain healthy?
Well, my favorite thing to say these days is a flexibility in your thought. Flexibility is essential to mental health. So I find myself saying that a lot. And I think it's in reaction to, people, I guess kids, and with, anxiety, coming in like, kind of very restricted in their ideas, strict on themselves, strict internally. And so anyway, so mental flexibility, cognitive flexibility, I've been saying that a lot lately. I think, what's what we've known for a long time, that what helps people is, being able to have metacognition. So being able to think about what you're thinking about. So that's a really good thing. So, you can start little with your kids, and be like, what are you thinking about? Penny for your thoughts, I mean, and just, have them in that habit of kind of thinking about what they're thinking about.
Yeah.
And so that's really protective. Another thing that pops to my mind is, all the studies on resiliency. There's a famous one that was done on the Isle of Wight, where they did a lot of resiliency studies that, showed that if a child could have at least one super great, dependable adult in their life, their parents could be terrible, but if they had a great mentor, if they had a great teacher, if they had a great grandma, if they had a great uncle or aunt,
Yeah.
so making sure that your child has that,
Like an anchor.
yeah, right,
they
exactly,
need the anchor.
right,
I mean,
yeah,
I was talking, there was a story about some individual who had a horrific, and I should know the name, but anyway, a horrific family. I mean, like mother, grandmother. I mean, there were lots of, a lot of pathology, a lot of violence, a lot of, substance abuse, abuse in general. And somehow this person turned out fabulous. And they had a person in their life who was that strong rock that was kind of there, not necessarily there on a day-by-day basis, but there in their life that they could kind of go to and get some common sense and come back into the chaos. But that person kind of pulled them along, and that made the difference in their life. So,
well, it's J.D. Vance's story, not to get political, but that's what made his
actually,
book
you're right.
such a success.
J.D. Vance was one of those individuals who, when you read the book, if you read Hillbilly Elegy, I read it, and it is it's a great book, you guys.
It is,
but it is the pathology that guy grew up in was astounding. And who he is today, I almost don't believe his background. I mean, when I look at him today and I kind of go, is that really true? Makes me wonder. But anyway, he did have that rock in his life. Anyway, so that is a good person. So you find a rock that you can rely upon. What else? Are you an exercise person? Do you?
Yes, absolutely. Yeah.
Okay.
Super important. Yeah. Super important. And I have a loved one in the hospital, and he's been in the hospital for 3 months. And boy, when you hit 80, you're going to need all the muscle you need, all the muscle you can muster, So, I mean, no, I am an exercise person. I think, that's so important for people. Yeah.
I also encourage, and you can go ahead.
Having the ability to have transcendent thought is also very protective for your brain. Now, whether that's, a belief in God and really having a practice in your belief in God, or, if that's not your thing, like at least being able to transcend and, having transcendent ideas.
Yeah. No, there's no question. Dr. Lynn, that, I mean, kids who grow up with a kind of sense of spirituality
Yes.
have their feet planted on the ground a little bit more. If the, I told my kids when they were growing up, I used to scare them. I would say, listen, Mom and I can't watch everything you're doing, but there's a God in heaven who can. Okay. And so you're ultimately going to be responsible to God, not to me. I'm not sure I always lived that. I kind of was a little bit dominating. But anyway, but that being said, I think that sense of awareness that there is something bigger going on in this universe than yourself does ground people. And certainly there's multiple studies that have shown that to be exactly true.
Absolutely. And it, getting back to, solid psychoanalytic theory, which, by the way, is based in ancient ideas. I mean, anything in psychoanalytic theory is also in the Vedic scriptures, in deep spiritual ideas, and Freud himself, really his marketing was amazing because he pulled from ancient Greek philosophy, and spiritual philosophy, with his famous Oedipal complex, that whole thing was, but what was I going to say? But so getting to the pandemic, another really important aspect of mental health is to really get aware of our proclivity to unconsciously think that we're omnipotent and omniscient. So we're all knowing. Basically, we unconsciously assign ourselves to be God, right?
Yeah.
So when people turn inward, that inevitably happens. So when all these kids were at home, they had a sense of omnipotence and omniscience that is devastating for your mental health, because we're not all knowing and we're not all powerful.
Yep.
And so getting back to your idea of what interaction goes. So if I interact with you and I'm thinking I know everything, but you're able to say, well, no, you don't, here's this thing and this thing. And, and so that helps me not walk away with the sense that I'm all knowing, and so that creates tremendous anxiety when you're assigning yourself God. It creates tremendous anxiety in your psyche.
I haven't quite got to that place where I thought I was God.
but it's anyway, unconscious. It's unconscious, so you might not be aware.
Thanks for the warning. Okay, appreciate that. So listen, I'm watching our time, and we're going to have to wrap it up here. But Deborah, thank you for taking the time, first of all, to come here to the studio. It means a lot to me. I think that there's a dynamic nature of a real conversation. Yeah. Not to say that Zoom conversations are bad, right. But this is different. Yeah. And so thanks for that. How do people find you out there?
Okay. Well, I'm just, over the last few years, I've developed a collective that colleagues and I have gotten together, and we, there's the Center for Authenticity. So that's my official website. And I'm there with my colleagues that we all kind of try and support each other, talking about, connection. Yeah. But essentially, they can just,
So the Center for Authenticity. So if they Google that, they'll find you.
They'll find me
in Los Angeles.
Yes, and you can, email me at Doctor. I can give you my details to you.
Okay. Yeah. Okay. So she Deborah Lynn spells her name Lynn, MD, and she's in Westwood, California. If you need to find her, if you need psychiatric help, psychoanalytic help, she's the one. All right. And so Deborah, thank you. You've been very wonderful to talk to, and hopefully the people listening out there will have gleaned a piece of a little thread of something that will help them, because we're all dealing with things. It turns out that as I do my job day by day, and I see people who, moms and dads and all of us, we're all there are things going on in their mind that are ringing bells, and we're concerned about. We all have issues. We all have things, and so.
Yes.
Hopefully we have spoken to some people out there who are listening today.
That's right.
So friends, we're going to end it there. Deborah, thank you again for being here.
You're welcome. I had so much fun.
And for those of you listening, thank you guys for tuning into the Hamilton Review, where kids and culture collide. Until next time, be well. Bye-bye.
You have been listening to the Hamilton Review, where kids and culture collide. Thank you for allowing us to be a part of your day. Tune in again next week on Apple Podcast. Rate and comment and tell a friend.